Welcome back. Well, now we are joined, that is by Ben Nangombe, the Executive Director of, that is in the Ministry of Health and Social Services, as we mark this year's World Health Day. Now, today we will be discussing the significance of this Global Health Awareness Day and the Ministry of Health's efforts to promote and protect the health and well-being of all Namibians. World Health Day is celebrated annually on April the 5th, rather the 7th, and it serves as a platform to raise awareness about critical health issues and mobilize resources to address them. Good evening, Edie, and welcome to the Daily Roundup.
Good evening. Thank you for having me. How are you today?
I'm very well, thank you. Now, Edie, how would you describe Namibia's progress in the health sector since the last performance review, and particularly in terms of attaining its targets and implementing strategies?
Thank you very much once again. And this is a very important platform to share with the Namibian public the activities that the ministry is undertaking, the programs that we are implementing, specifically with respect to what we are referring to as health system strengthening. So when we look at the overall picture, I think we can say that Namibia is fortunate to have a public healthcare system that works and delivers for the Namibian people. You will know that more than 85% of the Namibian people depend on public healthcare services. We have a network of health facilities in terms of outreach points, more than 1,000 of them, clinics, health centers, district hospitals, intermediate hospitals, and the national referral hospitals. These facilities are catering to the health needs of the Namibian people. So in terms of infrastructure, there is a large footprint all across the country. Of course, some of the infrastructure has aged, but we are working methodically and deliberately to be able to maintain, to renovate, and to even build new health infrastructure. That is on the side of infrastructure. We are building, for example, now the Windhoek District Hospital. Windhoek, the Commerce region, did not have a district hospital, so we are building one. Cabinet has directed that we carry out a groundbreaking ceremony in May, this coming month, to be able to build that. And that is in addition to other facilities that we are building across the country, from Ausen Care to the Zambezi region to other regions across the country. And also what we are looking at is the construction of other important projects. We are looking at the mobilization of resources to build a multi-regional hospital in Otjiwarongo. We are looking at mobilization of resources to build a district hospital in Kurenkuru, in Oshana, in other areas. And then you have the question of the development of human resources. Of course, we have a dichotomy of trying to contain the imperative of containing the public health wage bill or the public service wage bill, but at the same time, we are also saying, in order to be able to implement and serve the Namibian people, we need to have the feet on the ground. You need the warm bodies, you need the doctors, you need the nurses, you need the pharmacists, you need all other cadres in the health sector who should be able to carry out these duties. And then you have the question of medical equipment. We know that the provision of healthcare services, there are equipment that aid in the delivery of the services, whether it is diagnostics and others, whether it is treatment for cancer, for example, whether it is CT scans, whether it is MRIs and other pieces of equipment. We are in the process of renewing and buying new equipment, bringing them on board, commissioning them in order to be able to serve the Namibian people. Then I have the question of pharmaceuticals, for example. And you need to have the requisite pharmaceuticals, you need to have the requisite clinical supplies in order to, again, ensure that people have access. The theme for this year for World Health Day is My Health, My Right. What we are saying here is that the people of Namibia should be able to enjoy access to good health, access to a clean environment, access to a proper diet and nutrition, access to services that are required, and freedom from discrimination. So all these issues, when you look at the broader picture, is to say Namibia is one of the countries that are committed to the implementation of universal health coverage. Universal health coverage basically means that the people of Namibia would have access to healthcare services without suffering financial catastrophe.
All right. Now, Edie, maybe just share with us some of the key findings from the recent health sector program review and how they will inform, that is, the development of national health policy, as well as the next health sector strategic plan 2022-2027.
Yes, so basically we conduct these reviews periodically to inform decision making, because you need to have data on the latest situation on the ground, because data is what determines what you are able to implement, so because you cannot implement what you cannot measure. So what the reviews have informed us is that there are specific strategic areas that we need to look at. So for example, we have found that there is an imperative to ensure that we look at the promotion of primary health care, because good health must start at home. Good health must start in our communities. Good health must start in our schools. And health must be also a personal responsibility of the Namibian people. So primary health care is going to be that tool that is going to enable us to strengthen a health system, to enable our people to enjoy good health. We need to look at the question of both communicable and non-communicable diseases, and specifically non-communicable diseases, because these diseases of lifestyle, for example, when it comes to diabetes or hypertension or some forms of cancer, are things that happen because of the behavior of people. So we need to go back again and re-educate the public about the importance of good behavior that would not encourage the development of diseases. So these are some of the issues. We have also found that we need to progress with the world as it's moving forward. So the issues of what is known as e-health, the electronic health systems, so that, for example, when it comes to the storage of data of patients, the retrieval of that data, people need to have what is known as unique patient identifier, so that if a particular individual goes to a public health facility, this record is called up and the details of that person are contained in that specific unique patient identifier. So what we have done, for example, is to install the information network infrastructure in all the district hospitals around the country. We have already also granted a contract to a company to connect all the health centers around the country. We have piloted the modules of this e-health system, so that, for example, when it comes to patient registration, when it comes to the questions of billing, so that even people who have medical aid funds who want to be treated in the public facilities, they can go to the public health facilities and be treated, and we can bill them for the services, and these funds can, of course, go to government quotas.
Right. Deputy, Rather Edie, we will like to talk to you the whole day, but due to time, we have to let you go.
Okay.
Oh, thank you so much for making time for us.
Thank you very much for making time for us.
All right.
We have more to share. And please call us in anytime you have an opportunity. So
always. Thank you so much, Edie.
Appreciate it.
All right. Now, that was Ben Nangombe, the Executive Director that is in the Ministry of Health and Social Services, talking to us about the significance of World Health Day, and that is how the ministry, or rather the Ministries of Health's efforts to promote and protect the health and well-being of all Namibians. Now, thank you so so much for watching. That wraps up tonight's edition of the Daily Roundup. We'll be back tomorrow, same time, same place.
Thank you very much.